Well, 2 years ago this month, COVID gained pandemic status, and it was around this time that Mecklenburg County was preparing to lock down. We were all struggling just to make sense of everything we were thrust into. Amid that confusion, health leaders emerged.
That's right. And I sat down with the North Carolina doctor who unexpectedly became the face of pandemic response for Novant Health. He shared with me how the pandemic has shown our ability to triumph, but he also says there are some things we just haven't figured out quite yet.
I'm tired, and sometimes you're tired because you've come through something and you think, we did a good job, we did the best we could. And I feel like we spin it all, right? You don't figure out someone's character unless you go through a trial.
And with the pandemic still underway, that trial is lasting. Dr. David Priest is the Chief Safety, Quality, and Epidemiology Officer for Novant Health. But thanks to 2 years of weekly pandemic updates shared on TV and in newspapers across the Carolinas,
increasing amounts of immunity in the population.
Most folks simply know him as the guy who knows a lot about COVID.
I was actually walking on the street the other day and somebody yelled out the window, waved or something. I didn't know they were.
As an infectious disease specialist, Priest was tasked with keeping up with the ever-changing COVID landscape. And like most of us, he remembers the moment he realized the virus was going to change everything.
February of 2020, I was out of town, and my phone rang and someone said, we have a team member coming back from Asia. What's up with this SARS-CoV-2 thing?
A major triumph for him was when he saw COVID vaccines started rolling out. But he says that pandemic tool was also a source of dismay when he saw how the country failed to unite in its use.
I think there were moments when I felt like we weren't going to get where we needed to be in terms of vaccination rates. Those were hard days when I thought, man, here's a tool that would protect a lot of people, and it's not going to be utilized to the extent it could be.
And as the pandemic pressed what he saw as an already divided country, he also says it unveiled other core concerns.
Kind of think of the American healthcare system as kind of like a dilapidated house with a Ferrari in the driveway. We have a lot of great toys and a lot of great tools. At the foundation of the house, the public health, the monitoring for pandemic, preventative health care, we just have ignored that for a while, and we've paid a price for that.
But with that cost, he hopes there is a lesson.
What good can come out of this about how public health works, about how the healthcare industry works, about racial reconciliation, about what happens on social media, about how we treat each other?
Yep, looking for the good that came out of all of this bad. You know, you heard Dr. Priest mention social media. He also had a really great insight about how impactful that was on the outcome of this pandemic and really how it's playing out, remarking in his words, these are his words, underfunded, local health departments and even the CDC are no match for the 24/7, 365 social media machine. So he said that's just another thing we need to work on. Communication, figuring out how to message, how to talk to each other too.